Good afternoon, everyone. Raise your hand if you heard of PCOS. PCOS is polycystic ovarian syndrome. PCOS is a metabolic ovarian syndrome. So now they named it to PMOS because it's not just about the ovaries. PCOS and PMOS affects 1 in 10 women in the reproductive age. Today, I will explain what PCOS and PMOS symptoms causes and what's treatment and how can we manage it. What is PCOS and PMOS? It's a hormonal and metabolic issue. Ovaries can reproduce too much androgen. It can affect your menstrual cycle, ovulation, your fertility, your blood sugar, your metabolism. It's not just about ovarian cyst. What are the true symptoms of PCOS/PMOS? Irregular or missed periods, weight gain or difficult losing weight, acne, which is cystic acne is the main one, excessive facial and body hair, fertility challenges, a lot of fatigue, and insulin resistance issues. Everyone's symptoms can be different. No one knows the true cause and reasoning of PCOS. Genetics can play a slight role in it, and there's no exact study on what causes it. It can be genetics, it can be your upbringing, it can happen when your mom is pregnant with you. There is no way that we know. As of right now, they're still doing research, but there's no exact cause. The diagnosis process can be a little tricky. They look at your medical history, they can give you ultrasounds, they do blood tests, they can do a physical exam, and sometimes doctors don't always diagnose PCOS right away or PMOS right away. They wanted to give it like a year to see what your symptoms are. And for some women, that could be very challenging because a year feeling unheard or feeling not cared for can be really bad for your mental and your physical health. Unfortunately, there's no cure, but PCOS, PMOS can be managed with a balanced diet and a regular exercise. Weight management, if appropriate. Medicine is likely prescribed metformin and birth control. A lot of women, once they get into the research, they do not like taking metformin and birth control because they feel like it's masking the exact problems. So, example, some women just take vitamins. Aspartame, anisotol, fish oil, Co12. They do not want to be on birth control and metformin because they mask symptoms. Also, metformin gives you a lot of horrible side effects, which can be nausea, constipation, dizziness, and it could bring your blood sugar way down. Even though it's supposed to help with blood sugar, it could bring it way down. So a lot of women opt out of taking metformin. And with birth control, especially if women are trying to have a kid, and PCOS number one cause is fertility, and they're on birth control, it doesn't make sense for all women. So a lot of women do not take birth control because they don't want to ruin their chances of fertility even more. Even if they're not wanting to have a kid right now, they still do not want to take birth control because the chances of ruining your fertility even more. And PCOS is sometimes referred to as PMOS, a common condition that affects hormone and metabolism. Early diagnosis and treatment can help you a lot. The sooner you catch on, the better. That's why a lot of women are frustrated when doctors make them wait a whole year of testing before diagnosing, because the sooner you catch on to your symptoms, the better life you can have. And thank you for listening.